Hi, this is Carrie Sheward with Applied Behavior Center for Autism with Jamie Kingston. She is a registered dental hygienist at the Hamilton County Pediatric Dentistry office, and our friend the elf hanging here. We came to this office, it's been several months ago, and addressed some kind of proactive strategies that they could implement to make a dental visit a little more smooth for anybody actually with dental visit sensitivity, with sensory issues, with behavioral challenges, with fears of coming to the dentist. We made a few suggestions and they took off with those and came up with an amazing strategy that I'm going to let Jamie talk a little bit more about, and take it away.
Okay. So, yes, we were really thankful for all of the suggestions, as obviously we know coming to the dentist is hard for a lot of kids, and we just want to make each appointment better and better. That is our goal. So we started out just with when parents call in addition to medical history, Carrie suggested we ask if there were any behavioral concerns, so we could address that before they actually came in. And then we just kind of made a little extra medical history. It's more about behavior or communication or sensory, where we can ask a lot of questions, and those can be done by phone. Anything from, is your child going to have an issue with taste? Do they prefer the rooms to be quiet? And we tried to kind of just start a conversation here. Of course, when patients call to make a new patient appointment, we always offer a meet and greet. So if they want to come in the office and just walk around, meet some of the staff, where we're not doing any treatment that day, we do offer that. And so if they are coming in, a lot of times we'll do this then rather than on the phone.
I think oftentimes families are hesitant to say, oh gosh, my child has behavioral challenges, or this might take a little longer than usual, because they're afraid they won't want to be seen at that location. But this is a smaller location. We have Dr. Jensen is the one dental person, and then you have how many staff?
We just have a staff of 5.
Yes.
So we have, I'm the only dental hygienist here. I work with Sierra, my hygiene assistant, and then we have an assistant for Dr. Jensen and a couple ladies up front. So your child's always going to be seeing the same person each time, and we do quite a bit of time for those first visits, so we can take it slow and answer all of your questions. So we also kind of took what you guys told us, and we developed a couple different kinds of things with our program. So one was a checklist for today's visit to the dentist. And a lot of times we use this even for our very young new patients we start seeing kids at the age of 1. And that way we can kind of have a start and an end to each thing, which a lot of people want to know. When are we done? When are we getting our toy? And so we can do this. We can make check marks. Sometimes we make smiley faces, and we just kind of move through the list, and the kids can either check off or I can check off. Sometimes we make a deal that we're only doing half. Other times we implement breaks. So we can do 5 things, take a break. And so we can draw on this as dry erase, and we also can copy these and send these home. So if parents want to work through the steps like that. And then we also made a visual schedule. So since a lot of kids maybe aren't able to read or prefer to see pictures, we just made a flip book about Ready, Set, Let's Go. And it goes through every single thing we're gonna do, whether it's something basic, like sitting in the chair, or it gets more complicated where, we're gonna floss. And it has a picture of our staff doing that activity. And then they know that, hey, we're getting close to being to the end of the book. And at the end of the book, then, hey, we're all done. We're happy-faced, and we get to go get our toy, whatever that looks like, whether it's our toy tower or something else. So, and these are able to be checked out too. So a lot of parents will check these out like a couple weeks before the appointment, and then bring it back, and we'll use it here in the office.
That is fantastic. Mackin, if you can kind of scan around, this is your open bay area, and then we'll go back. There's also a couple private rooms if people choose that as an alternative.
So this area we usually move to after we've had a few appointments, because we're not talking as much, we don't need it as quiet, or siblings will be here. But then we have our more private rooms where the door can be shut if they want. Lights can be turned on. Movies can be more personal.
And we talked a little bit, so the first visit is usually an hour? Is that
Yes, our
correct?
first visit for all of our new patients is usually an hour. So we will do a little chat about the medical history if we haven't done that. We'll come back and get a toothbrush, pick a movie, do a little bit of fun, and then we always do tell, show, do beforehand. And then we go ahead and do the appointment. If someone has had a meet and greet and they want to come in for that, we'll basically go through all the steps abbreviated without actually doing treatment. So, and then sometimes they want to do just a desensitization type program. So we have some kids that will come in, they'll sit in the waiting room, grab a toothbrush, and they're done for the day. And then we'll do a little bit more next time. So we kind of just tailor to what we think is going to work for your child, whether it's working on it here or checking things out and working on it at home.
Perfect. All right. So if anyone has questions or they're curious and want to make an appointment or maybe want to do a meet and greet, feel free to contact Hamilton County Pediatric Dentistry. What is your number?
317-846-5893.
All right. Thank you so much.